Good evening and welcome to this latest episode of the Pandemic Podcast with me, Dan Astin-Gregory. Tonight, commenting on Boris Johnson's, the Prime Minister's latest press conference. Those of you watching from the UK may have, as I did when you received the news that there'll be a Prime Minister press conference tonight, start to be concerned that there would be news of further restrictions. The good news at present, at least, is that there will be no further restrictions in England or other parts of the UK, which of course are dependent upon the respective leaders of the devolved nations. But no good news in one sense, no further restrictions in the UK. But Boris Johnson kind of stumbled and stuttered his way through a very befuddling series of mixed messages, really, even picked upon by the BBC in their debrief of the situation. But in this episode tonight, I'm going to talk you through some of the points that were raised, some of the key questions that remain unanswered, and some of the data points that need further investigation. Because as you may or may not know, certainly if you're watching this for the first time or you're scrutinising the Prime Minister's press conferences for the first time or new to looking at the data, it's really important that we take what is shared at these press conferences with somewhat of a pinch of salt because there are many flaws with the way that the data is collected, curated and presented, some of which I will take you through and identify tonight. I've been looking I've been hunting for some of the background data that would support tonight's episode following the announcement, but in the short time that I've had available, I've not been able to pull all of the necessary data together. But watch your space over the next few days. I'm going to seek out some of the key underlying data and show some of the challenges. So during the course of the presentation, the Prime Minister talked about record numbers of cases. For those of you who are surrounded by people who are worried about firstly, let's be clear about why this record number was achieved, because it included some backlogs from Northern Ireland. There was 4 days worth of data included from Northern Ireland and 2 days worth of data included from Wales, which of course increased the daily number. So it's not an accurate reflection of the number of cases in a particular day. Nonetheless, the number of cases are on the rise or have been on the rise, as have the volume of testing, of course. And that's why you're hearing reports of tests running out, because we're seeing an obscene level of testing. And I did ponder the question today. I wonder if, as a matter of course, if we were to test in prior winters for every shred of a cold that was present within the United Kingdom on any given day during a winter peak, how many cases of a cold you would discover, and how many of those would still be in their very mild form or asymptomatic? Because what's been very evident so far, whilst there are still complications with the Omicron variant, it's showing itself to be a much milder form of the virus, and therefore the presentation of severe symptoms and hospitalizations has been lower than previous variants. And in fact, some of the analysts looking at the symptoms profile have suggested the symptoms are more akin to that of a common cold. And with so many infections, you can quite clearly see there's a gaping wedge between the number of cases recorded and the number of people hospitalized. And even more positive, the levels of mortality are exceptionally low still and have not moved in accordance with this perceived rise in cases. So in terms of the overall risk of dying from Omicron, significantly lower than previously seen. Now, that's of course what the scientific community are attributing to the vaccines, but of course there are other factors such as pre-existing immunity from being exposed now with so many cases, and obviously the diminishing severity of Omicron itself. Now, despite this, of course, there's been a lot in the press around the pressure on the NHS. Now, let's not forget, if you have your wits about you, you'll notice that every winter we see hysteria regarding this is true pre-COVID times as well, BC before COVID. we see these winter pressures. In fact, you may have seen some of the graphics. I've circulated it myself several times of the headlines from the last 10 years from the Guardian, the Telegraph, etc., which show that there's always hysterical headlines around the demands on the NHS. Now, I'm not underplaying of course, the demands and pressures on the NHS at winter. That's a very real situation. But I make the points on the basis of relativity and context, because as with all of this, we only ever see the myopic, singular focused data on COVID admissions. Without any wider context. And I'm going to talk about some of the challenges with the COVID specific data in a moment, but we don't get any of the wider context of what is the actual burden upon the NHS, full stop, compared to the 5-year average or the 10-year average. Are we seeing any undue winter pressures that are exceptional to the previous norm? When we previously looked at the data on this on the Pandemic podcast, we've seen that the reverse is true, that there's actually, for many of the trusts, they've had less admissions than prior years for various different reasons. So it's important that we get that context, but we don't see that context. And that's one of the pieces of data that I was hoping to be able to bring for you tonight on the podcast, but I've not been able to pull it together in time. So watch this space over the next few days. I'll pull together that information and we'll look at the contextual information to look at the position of the NHS in terms of admissions versus prior years, because surely we'd agree that information is essential to make an assessment of the winter pressures on the NHS. But of course, as we know, the NHS is always under pressure at winter. Now, that's not necessarily acceptable, and it's something that, once again, the current government have done nothing to address over the previous years, although some would argue that it's the strategy of the NHS in the UK to run at capacity for efficiency, so that outside of the winter period, it warrants less expenditure. But from a public health perspective, it makes no sense to be run ragged every single winter. So it's important that point is addressed on a contextual basis. Now, speaking of hospitalisations and the NHS, Boris actually used the term NHS is on a war footing. Well, based on what I've just said, it could emerge that indeed the NHS is always on a war footing on the winter on a winter season by that definition. Again, we lack complete context, and that therefore becomes very difficult. And again, I'm not denying if any of the NHS workers watching this, perhaps, and I know there's a number of you out there, and thank you for tuning in, thank you for sharing this, and thank you for also sharing your real life experiences that we receive through the Pandemic podcast, the insights and emails that we get from the NHS workers to bring a sense of reality to what's really happening. I'm not taking anything away from those pressures. It is very hard during winter. However, we lack that context. So let's talk a little bit about some of the challenges regarding the hospitalization data. Well, firstly, of course, number one, we've talked about context. We don't have that. That's a missing context that's obviously required in order to assess winter pressures vis-a-vis previous years. But we've also seen, and this shows how effective that some of the social media activism, some of the collectivism, if you will, that we've seen over the recent months, challenging the data. In fact, over the last 2 to 3 weeks, you'll see that there's been a huge rise in people publicly challenging available data, which is reflected in the fact that for once, when the data was presented today from the NHS hospital admissions, it was recognised that there are a number of what's known as incidental hospitalizations attributed to COVID-19. Now, I first broke this on the Pandemic podcast way back in October 2020. And I remember when I discovered that the COVID data the COVID hospitalization data didn't just include people who were symptomatic of COVID and being treated for COVID, but it just included anyone that had had a positive test in the previous 28 days. So they could have had a car accident, fallen off a ladder, a whole manner of different ailments, illnesses, accidents, and be considered as a COVID hospitalization. This is still, despite being nearly 2 years later, it's still the same case. We still see this. It's the same measure that's used. So the incidental tests are those who have tested positive in the last 28 days, but are still considered a COVID admission. And of course, those who are tested positive upon admission, a nosocomial, it could be known as a nosocomial case where it's a positive subsequent to admission or upon admission. So we're here, there is a big question mark is in the Telegraph in the last 10 days. it was shown that 80%, up to 80% of the cases who were hospitalized were incidental, i.e. they're not, or 75 to 80% were not actual genuine cases, leaving just 20% as genuine cases. The government data that was showed today almost showed the reverse of that. So we're going to need some further clarification on what is the real picture when it comes to incidental cases and nosocomial cases, because of course what we should be really concerned about here in Common Sense Corner is the number of people. And I find it just insane that as an adult, I'm saying this on a podcast over and over again. And I'm sorry to those of you who've been following the content for well over a year now. I do keep saying the same things, but I'm reminded of there was a story told by Anthony Robbins, the peak performance leader. He tells a story about how there was a religious preacher who kept giving the same sermon every single week in church. And when the preacher was asked why he keeps giving the same sermon, he said, well, I'll keep telling the same thing until the people pay attention. And I feel like that's the same case here, because we've been talking about this issue continually since, well, I've been talking about it since October 2020, a long time now, about how this, just testing positive and being marked as a hospitalization for COVID is irrational. It's insane. It's absurd, because it gives us no indication and some people, when they hear this for the first time, they're like, no, that can't be true. That can't be true. They would never do that. Well, I'm sorry, it's true. And in fact, I saw a post just today from New York where one of the doctors had this aha moment and recognized that this was happening. And it's like, yes, my friend, this has been happening for a very long time, and the statistics are therefore completely useless, really, unless you just simply want to know how many people are currently in hospital that have got fragments of a virus within their body, of which, if it's from a PCR test, could have been from the last 90 days plus, and not show any sign of infection, which will bring me to another point in a minute. So we have this hospitalization data that doesn't even tell us how many people are in hospital with COVID symptoms or being treated for COVID. We even have with the mechanical ventilation data. It was revealed last year that the mechanical ventilation data isn't necessarily people in having mechanical ventilation. It's just people in beds that are capable of mechanical ventilation. And of course, if they're talking about bed pressures, etc., well, of course, some people might be putting in mechanical ventilation beds just simply because they haven't got the space elsewhere. So we have all these complications. So we don't actually know how many are genuine COVID cases and hospitalizations. I'm sure that there is, given the volume of increased cases, there would be some level of increase. But what I'm asking, and what we should all be asking, is for transparency. We should be asking for transparency. We should be demanding that not only the government, but the NHS to say, look, enough's enough. It's 2022 now. Let's start to do things properly. Please, can we do things properly? And can we start tracking those people who have got, or at least you can continue, if you wish, to track those who are positive in the last 28 days or on admission. You can continue doing that to your own delight. But for the purposes of monitoring the impact of COVID-19 upon the healthcare system, can we please do the insane and the sane, not insane, the sane and rational thing of just tracking those people who had been admitted because they have symptoms that require treatment of symptoms of COVID-19 that require treatment. Common Sense Corner, any rational human being can see that makes sense. So, regardless of what people think about vaccines or the severity of COVID, we could all surely, at least 90% of the population, because you have to account for 10% of people who are just a bit to put a hand up and say, well, that makes sense. Let's do that so we can get a better idea. So maybe we need a campaign on that. That's I've got a whole list of campaigns right now. I spent too much time by myself over Christmas. My team say it's dangerous because I'm always full of ideas, and I've got a long list of campaigns that I want to bring to the table in the next few months. Sorry to my team watching this live. You've just heard about it for the first time here. It's my first day back in office. Staff absences. Let's talk about staff absences. So the same problem is true with staff absences in the NHS. We're seeing the NHS under pressure. We've talked about that. And they've also talked about the volume of staff that are currently sick with COVID. And again, we have the same problem here. how many people, and I know, I told the story about the sermon, the preacher of the sermon, to pre-qualify the fact that I'm going to bang on about this at scale for this broadcast. So staff absences, same story. People who are sick with COVID. Right. Okay. So how many NHS staff members are currently off work because they have symptoms of COVID-19 and they are therefore recuperating from being unwell, versus those who have simply tested positive because they are forced to test on such a frequent basis? It's bemusing that, and I asked this of an NHS doctor on Twitter who was talking about the problem. I said, how many of your staff are currently off because they've simply tested positive but aren't in any way sick? They're not willing to answer these questions, but they should be willing to answer these questions, because it's this that's putting the pressure on the NHS. Now, of course, if they are positive and therefore and they're infectious, I'm not going to be saying you should be sending your NHS staff workers into hospital to potentially put others at risk that you're treating. Although when I say things like that out loud, I still start to think about previous winters where people may go in with mild colds or early signs of influenza, both of which would become a risk factor to the patients. I'm not normalizing that or saying that that's a good thing. Maybe there is something culturally we need to look at in terms of, I remember back in my days in corporate, they'd expect you to come in even if you're kind of hanging, you're absolutely dripping in a cold. It's not necessarily a good thing that we live in such a commercial culture that we can't actually take the time off and be paid to rest. But that's a different story. But nonetheless, the point remains true. How many people within the NHS, how many staff within the NHS are currently absent because they've simply tested positive? Now, on this point, again, going into common sense corner, rational ground here, wouldn't it make sense? Look, let's just talk this out. And I'm willing to talk to anyone from the NHS or the scientific community or any doctor to discuss this and debate it, because together we can actually create change. We can actually change things. It's important that we do. So here we are. Let's talk about both the incidental cases of COVID-19 where someone has merely tested positive, not demonstrating any symptoms. Secondly, let's talk about the staff absences due to COVID-19 who are also not necessarily demonstrating any symptoms. Now, at this point, wouldn't it make sense to do a sample study of those people who are asymptomatic, i.e. they've tested positive, demonstrating no symptoms, to do a sample study to actually verify the level of infectivity of both the patients who are incidental and the staff members that are sick due to testing positive? Now, you could do that with a simple viral culture. It's been done before. There was a study in China that took 300 asymptomatic cases. They did a viral culture for all 300. Not one of them came back as infectious. Not one of them came back as a live infection. Therefore, you can deem that those 300 people are not a risk to other people. So wouldn't it make sense to do even just a small sample study where you take a number of people who are asymptomatic, they're in incidental hospital, you've got the people there, they're in hospital, you've got the staff, you've got the patients, to do a small study to see what percentage of those are actually infectious rather, and therefore capable or having sufficient viral load to actually transmit to others. My hypothesis would be an enormous amount of those people who are incidental admissions, i.e. admitted for something else other than COVID but happen to have tested positive, or a staff member that has tested positive, again, no symptoms. My hypothesis was that an enormous amount of them, if not all of them, would not be infectious. So if you're from the NHS and you're watching this, or you know someone in the NHS, tag them and let's see if we can do the right thing and set up a study. And if you're an academic, you work in a university, and you want to do this, I'm sure we can raise our hand and say, look, we've got this idea. Can we fund it? Can we raise it? Enough of us are sick to death of COVID that we'll all put our hand up. Enough people put their hand in their pocket and say, you know what? Take my money, go and do the study, and let's get over this thing, because we've got to start applying common sense to this stuff. We've got to. This is all the show, the Pandemic Podcast. I started it to make sense of the stuff that didn't make sense in the world. And I can't believe I'm here in 2022 still doing the same thing, banging the drum. Anyway, so we've talked about incidental cases, we've talked about staff absences. Both of these points were made during the Prime Minister press conference, but there's clear issues there, of course. And the third piece is the relative capacity versus prior years, which is really, really important. Now, the other piece around testing is, that they're now talking about increasing the capacity of testing for key workers and various other working, where various other important industries that shouldn't be disrupted by a shortage in tests, for instance. Now, we have to again apply the same logic to mass asymptomatic testing. Look at the positivity rates. We're literally, well, here's a side issue. Just think, if you've seen the lateral flow test, these small plastic things. Think about how much plastic is going out into landfill now. Where are all the climate change and the ecologists saying, banging the drum, saying, why are we doing so many tests? It's literally, the same with masks. We're just absolutely destroying the environment with these tests. That's a side issue, but from an asymptomatic point of view, why are we doing? Think about the cost and the number of tests. Think about how many tests it takes to find a genuine positive symptomatic case of COVID-19. The number, and again, I said I don't have all the data for you today. I'm going to try and find that data. I'm going to find the data at least that will show you how many tests per case there is on average, because given all the previous points, I'm not going to be able to tell you how many of those cases are symptomatic, because again, lo and behold, if you're just tuning in to Skeptic Corner over here or Common Sense Corner with me for the first time, and you're just looking at this thinking this doesn't make sense, and I say this now 2 years in, because a lot of people are suddenly realizing that none of this stuff makes sense, and I'm trying to speak to those of you who've been on the journey for 12 months, 18 months, 2 years, and those of you who are just on the journey. It's quite hard. I need two audiences over here. But so with testing, it takes an enormous amount of tests to find a genuine symptomatic case. And again, of course, in all the case data, if you hadn't realized, all the case data, it doesn't distinguish between those who are symptomatic and those asymptomatic. It doesn't distinguish between those who test positive on day 1, develop symptoms on day 5 or 10. It doesn't tell you any information. We have no information about whether any of those people actually become sick. So we've got all these cases with no case definition of a sick person, which is, again, it's absurd. So if you're learning this for the first time, welcome to our world. If you've heard this 1,000 times, I'm sorry. Again, we just got to keep banging the point home, because we've got to tackle this absurdity. Enough is enough. It's 2022. We've got to move on. We've got to tackle this absurdity. Anyway, of course, none of this is talked about in the Prime Minister's conference, and none of this is talked about in the Prime Minister questions. The media who are invited to ask questions. Do they ask questions about these things? No, of course they don't. So what else came up? Oh, of course, the issue of boosters. The issue of boosters came up. So, of course, it became the Prime Minister conference, press conference, became, as usual, a veiled sales pitch for the boosters. This is the only exit route that has been put forward by pretty much all of the governments around the world, although El Salvador today put out a video showing what I would describe as sound public health information, which basically gave risk-based information about COVID-19, told you to get healthy, and told you to take a bit better care of yourself if you're not as healthy. Anyway, that's a different story. So again, the false information that keeps getting put out about the number of people who are currently hospitalized, who are vaccinated, and those who are unvaccinated, this number of 90%. And if you're not yet following Jamie Jenkins on Twitter, Jamie Jenkins he was previously the head of health statistics at the Office of National Statistics. You can find him at StatsJamie on Twitter. He's also on Facebook. He's on Getter as well. You'll find him on Instagram. I'll put the links in the comments. But this guy he's amazing. He's an ex-head of health at stats at the ONS. He's constantly now fact-checking the information that the government is putting out. So case in point, he's literally perfect timing. Here it is. I was hoping he would do this. I did my own verification. I had older data. He's got some newer data here. So Boris talked about as many as 90% of those in intensive care with COVID have not had their booster, and over 60% have not had any vaccination at all. So he's now he does this. This is like a daily fact check. So he's fact checked data for December shows that 61% of patients with COVID in ICU are unvaccinated. So it's not 90%. So in fact, I'm not convinced that's the correct number either. So I'm going to challenge that because it's the latest data. He's got the latest unpublished data. So we'll look at the published data. But if you look at the actual published data from December, and I'm not questioning his interpretation, but again, it's from unpublished data. But if you look at the December published data from the vaccine surveillance report from the British government, it shows that actually it's only 45% of those in the ICU are unvaccinated, meaning 55% are vaccinated. So again, if you were to use very common sense corner maths, we know that many more people are vaccinated than unvaccinated. Therefore, proportionally, it's still there are still more people. Therefore, on a proportional basis, who are unvaccinated in the ICU. But nonetheless, the aggregate data that's been quoted on the press conferences is wrong. It's a lie. In fact, the 90% number comes from the under 18s. So the 90% comes from the under 18s. But of course, the under 18 data doesn't break it down by age group. So we know that the JCVI. We know that the chief medical officer in England has approved the vaccine for a certain number of age groups under 18, but there's plenty of people who may have been hospitalized within that figure who simply aren't eligible for a vaccine anyway. So and of course the take-up rates on the under 18 are much lower than the older age groups. So when you factor that in, they're using this 90% statistics, which is purely for the under 18. So you'd expect a majority. In fact, you'd expect all of it. I mean, in my world, I would hope that everyone under 18, except from perhaps the most immunosuppressed, most vulnerable people, who you may make an exception for, but you'd expect almost everyone who is under 18 to be. I at least would question very strongly that they shouldn't. Well, I would state quite plainly that I completely fundamentally disagree with vaccinating the under 18s full stop. But nonetheless, on point with the data, we can see that they're using this 90% stat for the under 18s, which is completely irrelevant. And in fact, if you subtract the under 18s from the overall data from the surveillance report, the number of people unvaccinated in ICU goes down to 41%. So it's complete manipulation of the data. But again, with this, as I mentioned, with some of these data points, we haven't got the very latest data. Jamie Jenkins, who I referred to, has published a fact check here, which shows some data from the very latest from November to December. As soon as I've got that data and able to verify it myself, I'll share it on another broadcast. But again, it's misinformation. The government is publicly lying in order to persuade people to get vaccinated or get the booster. And that's simply not acceptable. And again, coming back to Common Sense Corner, anyone with any shred of morals or ethics would surely agree that it's not right for governments to lie to their citizens in order to coerce them into making any particular decision. Surely, regardless of what your views are on vaccines, whether you're using the polarized terms of pro-vax or anti-vax, you would agree surely that it's not appropriate for any official to lie about the data. Now, the other point on the on the boosters or the vaccines more broadly, the chief medical officer, the now Sir Chris Whitty. Again, I'm going to do a whole new episode on that particular topic because over 500,000 people have signed a petition to have Tony Blair's knighthood revoked. I would very much like to originate a similar petition for the proponents of the COVID pandemic response in the United Kingdom, including the Chief Medical Officer Chris Whitty, to ensure that title is revoked. But that's a story for another day. But he said that the vaccine hesitant, on one hand, thankfully, he acknowledged that it's not a bunch of conspiracy theorists who are just, just coming out with propaganda why we shouldn't. Well, he said that in the first instance, the propaganda why we shouldn't take the vaccine, but then he diminished the actual adverse reactions, which I'll come to. Louise says it sounds like a circus. It was like a circus. The whole presentation was like a service. It was very unprofessional. It was bumbling. I know I'm bumbling quite a lot here tonight because there's a lot to say, but not quite in the same way, I hope. So Chris Whitty said that there are three questions that the unvaccinated are asking. Number one, is this a serious disease? He used the fact that people are being hospitalized as a justification to answer that question? Well, of course, for some, it's a serious disease. And in fact, if you want to look at data and statistics, there is a very clear, the clearest determinant of adverse outcomes from COVID-19 is age. That's the number one. So the older you are, the more vulnerable you are. It's a sliding scale, and it massively ramps up for the over 65, 70 plus. In fact, 70 plus is where it really ramps up. And then the other factor is your weight, obesity. And there's many other factors, comorbidities, of course, but we now know from the ICU data that 80% plus of people admitted to the hospitals with COVID, again, all the previous distinctions still apply, but 80% plus are considered overweight or obese according to the BMI scale. So we know that weight is a massive factor. So, keeping to focus on the vaccination status is one thing you can look at, but you can also look at overall underlying health conditions and their weight and their age. Now, you can't control your age, I'm afraid, but you can control your health conditions. There are some things that are hereditary, although science is now showing that there's a diminishing number of hereditary factors. But regardless, we can see that obviously we are able to take control of our own personal health. There are things we can do, exercise, eat well, etc., all those things that we should be taught in schools. But nonetheless, we didn't, and Boris actually did diminish this to say it's much quicker and easier. And this was also referred in the press conference. It's quicker and easier just to get a jab. Well, just getting a jab isn't going to make you a healthy individual. I'm afraid it's not going to turn you into a stud. It's not going to turn you into into someone that's bolstered their immune system holistically. It's simply, well, don't get me started. So there's three questions. Is this a serious disease? But by stating that the fact that people get hospitalized is evidence enough that it's a serious disease, well, of course, it's a serious disease for some people, for a minority of people. But you can't answer a question like that with a broad stroke. And this has been a problem for the last 2 years, is that they treat it though it's almost like an existential threat to everyone. We know it's not true. There are comorbidities, weight, age, major risk factors. For the rest of the healthy people, yes, there's always exceptions, but you can't say it's a serious disease to young people in general. It's just a lie. It's false. Number two, the question was, do the vaccines work? And again, they used the data, which again, if you look at the vaccine surveillance reports, you see all kinds of crazy modeling to say how many hospitalizations and deaths have been avoided. It's just insane when you look at the modeling. But the last question, an important one, which for what we've been covering most on the podcast, is the question of are they safe and the side effects. And Chris Whitty, once again, reduced the side effects down to misinformation and stated that there are people out there deliberately sharing information to cause concern about the side effects, and he described that as misinformation. Now, I would publicly invite the chief medical officer to a public debate, not with me, but with the relevant individuals, the scientists, the academics who have been tracking the adverse reaction data, but not just the adverse reaction data, looking at the all-cause mortality, because I'm hoping to bring you, there's a fantastic presentation that I was privy to from Canada in the last week. I'm hoping to bring kind of a director's cut version of that presentation, which analyzes the flaws in the trial process that Pfizer went through, but also shows you the flaws in the way that the side effects and adverse reactions are tracked and monitored. And one of the key things is a vaccine or any medical treatment should actually, because there was a cancer treatment that was shown to reduce the incidences of cancer, but as a side effect, it increases your risk of dying full stop. So the net result was more people died from this particular cancer drug. So you can't just look at adverse reactions from just, again, it's this myopic view of just COVID reductions in symptoms or reduction in hospitalizations and deaths. You've got to look at the adverse reaction data, and you've also got to look at the impact on all-cause mortality. And again, if we look at the all-cause mortality data, and I'll present it here on the podcast in the next few days, you look at the spike in December 2020 when the vaccines was first rolled out, you can see a spike in all-cause mortality. And again, from September onwards in 2021, you can see not as such a significant spike now, but you can see a rise in all-cause mortality, a consistent rise in all-cause mortality from September onwards, which is when the boosters, third jabs were released. Now, I'm not for full transparency. I'm not making a direct connection. I'm not saying that that's causation. I'm not saying it's even correlation. I'm saying it's reason to ask questions. So my invite would be, because there is sufficient data out there for cause for concern, you cannot just dismiss the safety effects as misinformation. It's very real. People are seeing the anecdotes, they're hearing the stories within their family groups, they're seeing the posts on social media of football players and athletes collapsing on the field and dying. People aren't stupid. To say this is misinformation is just simply unreasonable. It's putting it lightly. So I think it's time that we have a public debate on the issue of vaccine adverse reactions, because you cannot simply reduce it to misinformation. It's unethical and immoral once again, and it's simply not acceptable. So in summary, the press conference tonight, mixed messages. There was kind of like a battle between Boris and Valitz and Whitty, talking about the severity of Omicron. The one hand they're saying it's much less severe, then one of them said it's not. That's not the case. It's like a little tussle between all of them. No new restrictions, just really the standard of fare of a somewhat dose of reinforcement of fear, reinforcement of the old message of protecting our NHS. And again, from a personal perspective, I support the National Health Service and would like to see great change enacted to remove these winter pressures every season. But really, there was very little said. But watch this space, because they were very clearly not ruling out further restrictions. There's a cabinet meeting tomorrow, so things could even change on a dime in 24 hours. And then the last piece that has consequences that essentially was threatened that the boosters will be required to travel going forward. That was a hint for what's coming, not only within the UK and the rest of Europe, whereby vaccine passes, as we know, are tracking the number of doses that you're having. But it did hint that double vaccination may no longer be adequate enough for you to qualify for your vaccine COVID pass being green lighted. So watch this space. We could suddenly see an enormous amount of people who are double vaccinated suddenly being considered unvaccinated in this crazy roller coaster that we're on. And on the booster point, the final point on the boosters, a paper came out this week saying that this is repeated from previous insights, is that the boosters tend to wane by the 10-week mark. So you've got this 10 to 14 day period once you've had the booster, which makes you more vulnerable to infection, and then it wanes from 6 weeks to 10 weeks. So once again, you've got to ask the question, as Andrew Pollock has done, can we sustain this constant stream of boosters? Because the reality is, people are saying it's going to be every 6 months. Well, you can't say that it's going to be every 6 months and say they wane after 10 weeks. Quite clearly, Pfizer are going to be pushing, and the like Pfizer et al. Are going to be pushing for every 90 days. It's a subscription service now, and the digital vaccine passes are your digital loyalty card going forward. So there's lots of questions to be asked. There's many unanswered questions. And there's lots more to follow up on from here. So following this broadcast, as I said, the next few days I'll be gathering the supporting data to address some of the points that I challenged here on tonight's podcast. It's really important that we do that. Now, if you're watching this live, please do share this, whether you're watching it on Facebook, Twitter, YouTube, Odyssey. Please hit the share button. We need to be inviting more people to question what is happening, so we can all start to make sense of the world that does not make sense. So please hit the share button. And if you haven't already subscribed to our newsletter, it's our email newsletter. We send out very infrequent communications, but when we have guests coming on board, we like to send out a notification. So just go to danjgregory.com/pandemic, and you can join our mailing list where we'll keep you up to date. Plus, we are going to be launching our own private community network in the next few weeks to really look at how we can continue to make sense of the world that doesn't make sense, to look at two, how we can resist and campaign against these things, and number three, and importantly, how we can build a better future moving forward. So you want to be part of that community once we launch that. And lastly, if you would like to help us fund and build that, we are recruiting, and watch this space. We'll be putting out a number of roles in the near future, but we are raising funds to enable us to do that. If you'd like to help in that way, you can also go to danjgregory.com/supporter and help us in that way. So thank you very much for tuning in. Please do share this episode. And again, I'll be back later this week with the updated data to make sense even further of the unanswered questions that were left from the press conference this evening. So thank you very much for tuning in. Peace out for now. I look forward to seeing you on our next broadcast here on the Pandemic Podcast with me, Dan Astin-Gregory.